You're listening to another episode of All the Bees with me, Dr. G, and my scrub tech, Bree. Good morning, and we're back. I'm Dr. Kat Gallus, and you're listening to All the Bees, unfiltered plastic surgery podcast with me and Bree, and we're back. We've been on a little bit of hiatus where Bree talked to Dr. Chow, and then I talked to Ava, and now we're both in town again. So,
yeah, the dynamic duo is back.
That's right. Don't call it a comeback. And of course, I felt like when I spoke with Ava, there wasn't a lot of good celebrity goss, but today we are blessed with
this week.
I know. First of all, Starbucks brings back the fall menu on Tuesday. So already winning. And then
Travis Kelce is about to turn into Travis Swift.
That's right. The engagement everyone is talking about, which I think is just good for them, man. Good for them.
And then to top it all off, Meghan Markle sparks season 2.
Yeah, it's a lot. It's a busy week. I would say the Taylor Swift and Travis Kelce thing cracked me up. She's got some crazy ring that you gave a thumbs down to, I think, because you don't like the vintage look.
I didn't. And I know that's very T-Swift. Love that for her. Not for me. Of course, I don't have a diamond that big, so I can't really sit here and harp on it. But I mean, he would have been so dumb not to propose to her. So I know all the memes that are like, oh, we all know who Travis Kelce is. Sorry if there's any men listening. But she put him on the map for females. And I'm not a Taylor Swift fan either, but we all know who he is now.
Oh my God.
Unpopular opinion.
I just like the tweets and the quotes, how I'm getting more texts about Taylor Swift's engagement than I would ever get about my own.
Yeah, 100%. We all, our old surgery coordinator was obsessed with Taylor Swift. So all of us had texted her at one time and they're like, oh, just texted her. She loves Taylor Swift. Yeah, definitely got more texts about this than my engagement. That's for sure.
And then the other one I like is that prenup is about to be longer than any book Travis Kelce has ever read, which is also great.
I love that people think he's read a book. I do love him, so don't get me wrong, but the memes are killing it.
Well, I mean, I think this will be awesome, and I can just tell you I know somebody not getting invited to the wedding.
Okay.
Blake, no, not us, Blake Lively.
I know I just hated on it a little bit.
No. We were never getting invited. Let's 100% be real. But I think, she's our royals.
I wonder if maybe she won't be at the wedding.
I don't think.
Are we taking bets?
Okay.
All right.
It would be a massive friendship story arc for them to get back together, I think, at this point. But
yeah,
I don't know. We'll see.
No, we're about to have a lot of Swiftie babies.
Oh my gosh. Yeah, we'll see.
Yeah.
But yeah, speaking of the other faux royals, I can't say all that together.
Fox
royals. The Meghan Markle second season, which had been filmed pretty much right after the first season and is getting the usual 1 to 2 star reviews because it's just, so fake.
I think if she wasn't already filming the second season, she would have been canceled right off the bat because they did cancel it.
Yeah.
And it's a shame because she is I have no hate against her, but it was the most insensitive, out of touch, unrealistic, what is it? Inauthentic that I have seen. I was just telling her, one episode, she's talking about her mornings cooking a 4-course meal for her kids. I was like, you should have just seen me this morning trying to wash my daughter's hair because it smelled like shit. And then my toaster started on fire. So then I had to put it in the air fryer just to get one piece of avocado toast. This is just, you can't relate. You cannot
No,
relate. I'm not
no,
sitting on my
because
house.
we are not making homemade graham cracker s'mores with vanilla bean turmeric marshmallows.
No.
Also, if I made that, nobody in my house would eat that. They'd be like, "Get the turmeric off my damn
Yeah.
marshmallows."
They'd be like,
It's
absolutely not.
so yeah. I mean, a little bit of it, harkens back to way back when Martha Stewart, would make boiling an egg incredibly complicated, and, that created a brand for her, but this is just something to be mocked at this point because she just sounds like a really bad Hallmark card all the time, in my opinion. There are easy ways to show up lovingly. What? Easy? It's like you're gonna craft necklaces and make persimmon topped sourdough. Like, are we still doing sourdough?
I've
What?
had the starter for a week and a half since my sister made me purchase it, and I haven't even made it. So I'm not going to be doing that and crafting necklaces using pressed flowers for your child's individual birth months and setting them with a UV resin. It's easy.
I
Okay,
mean,
this is what I have to say to that. Just kidding.
I'll just say that, yeah, she's talking about being authentic and she's in a rental property down the road and like overly branding everything. And it just seems insane.
I
But
think,
yeah,
yeah, I think she could have made that a great show if she had just really like been a little bit more genuine and not been like, oh, this is all so easy because it's not easy. This is not easy for a working mom or a busy mom or even a stay-at-home mom,
yeah,
you know.
yeah, it's over aspirational and it's funny because at the same time she did an interview where she but kind of promoting the show talking about how when she still was with the royal family, how she felt like having to wear pantyhose, like nude pantyhose for every outing was inauthentic to herself.
Oh, and
What?
also
That's your
bowing to the
complaint?
queen. She made
Yeah.
this whole mockery of bowing to the queen, and then
Yeah.
they show it was just she
And
could have
then
done a little bit.
yeah, everything's like an aesthetic. She's just like one giant Pinterest board. That's
Yeah,
not real.
yeah,
Anyway,
and she sprinkles everything with edible flowers.
right.
Nobody will be eating that in my house. Not even me.
The article's great. It's just so easy to like, um, it's easy to mock. And all I kept thinking, so like in this quote, it says each episode sees Meghan throw together a over the top snack and drink for her guests' arrival before forcing them to participate in mandatory making and baking activity. Painting children's aprons using limes as stamps feels particularly unhinged. And then she presents
Okay.
them a gift on the way out. And these guests are not even like people she's ever met, like Queer Eyes Tan France is on there or Celebrity Chef. Like they aren't people that she actually knows, which is also more bizarre. Anyway,
Yeah.
all I kept thinking is now's a good time to have a labiaplasty because you can hate watch this during your 3-day recovery. And I feel like we had a slow season of nothing to watch.
Yeah, it went from Love Island to nothing,
Yeah.
so
You need something like not too compelling because you're not, you just need something to have on. And I feel like
yeah,
this is 3 days of laying flat and hate watching this nonsense would be
yeah.
great.
So my
So
advice is to put on episode 1, take your Oxy, and hope to God you go to sleep.
wake up after, I don't know, maybe when Chrissy Teigen's on.
Yeah, love her.
All right.
Um,
Okay, so that's my only way to relate that to anything plastic surgery, which is it is a good show to watch if you're recovering because you don't need like more than 2% of your brain, just enough to turn it
right.
on and fast forward as necessary. So, all right, so moving on to actual plastic surgery, adjacent celebrity news. We can talk about the Ozempic vulva, which is interesting. But I feel like if you just put Ozempic in front of a body part, you have a new trend, honestly.
Yeah.
So Ozempic face, Ozempic butt, and now we have Ozempic vagina. So we're just adding that to the list. That being said, we did get an inquiry the other day about the puff procedure, which is Ava was like, "What is this?" I was like, "Oh, yeah. That is injecting fat in the outer lips, so in the vulva area, if they're deflated and or droopy, you can puff them up. So it's exactly what it sounds like, which oftentimes in plastic surgery is not. So you can, if you have rapid weight loss, you can get visible skin sagging and laxity pretty much anywhere. It can be in your face, it can be in your butt, your boobs, and your inner and outer labia, your belly, your pubic mons, otherwise known as the fupa. All of those areas can sag. And one of the options is to add the volume back by putting fat in there. So I
Yeah.
think we'll probably see that trend on TikTok for a minute. And then because it's, like that BBL smell, it like people are like, wait, what? And then it dies down. And again, as we know, people lose weight in different areas first, faster. Some people lose it in their breasts, some people lose it in their butt. Like, you're always bemoaning the loss of any butt fat. So I think it's not going to be a thing for everybody. Like, not everyone on a GLP-1 has to panic. But
Right.
yeah, it's something that can be addressed. You can use your own fat. You can use filler like a hyaluronic acid filler. And you can use the fake fat, the aloclay, albeit that's a slightly more expensive
Ooh.
option. Mhm. Yeah. So not I keep calling it fake fat, which is not true. It's it's
It's kind of.
fat from somebody else that has been
Filtered to the
stripped of any DNA, filtered out so that it's really just a space holder until your own fat can come in and build up that area. But it is a volumizer and it does stimulate your own fat to come in there, and it's in a syringe. So you can just inject it without having to go under any anesthesia or have the fat harvested from somewhere else. It's a small area. You can't go crazy in there because you don't want to overfill. So it might take more than one session. And I feel like it's in that category of people who, like, this is your number one issue, like, or do you have other issues? Because I feel like if you have significant laxity there, you probably have significant laxity elsewhere, and you've either already addressed it or those other areas are going to prioritize,
right.
like your arms, your face, your boobs, any of those
Right.
things.
I feel like my
Um,
labia would be the last thing that I
yeah, on the
addressed.
list. Whatever. But if you have money to set on fire like Kim Kardashian, maybe you consider doing it.
Yeah, come get your labias fluffed. Fluffed and pretty.
Speaking of fluffy, Kim Kardashian's ex-pal Larsa Pippen denies plastic surgery rumors after she looks insane.
Sorry.
You just have to see the face to be like, why are you denying?
You don't have to deny. We are in the era of transparency. I mean,
Ugh, her face just looks super puffy, and I feel like some point she denies it by saying that she just had a bunch of PRP injected in her face and that's why it's puffy.
there's
And I'm
no
like,
way.
okay, well, PRP is still plastic surgery. Like, what? Like, what are you talking about? So it's just using, because I think she thinks because she's taking her own blood and re-injecting it. And I don't know. I don't know what her
Well,
logic
does it
is
make you
there.
look that puffy?
I mean, if someone injects a couple cc's under your eyes, I can attest to the fact that that can
But
make
it
you look puffy.
goes away.
I know, but I feel like she said she had done it like recently. She's on some show and her face is pretty swollen. And I feel like she probably had fat transfer and the
She didn't
swelling hasn't.
plan that
Yeah, she
around
didn't
her
plan
show.
her whatever, because you see how she's in that dress with a little mic? It's like a recent appearance, and I think in the article she mentions that she had something, i.e. not plastic surgery, but okay, aesthetic enhancement, uh, like a week or 2 earlier, and that she was recovering from it. But PRP or fat, either one is, your face could be swollen if they, like, layered it in everywhere
Yeah.
up to 2 weeks later, so I don't know why I don't know that it's a shocking transformation. I feel like she just
I feel like
has
she's always looked like that.
a ton of makeup on. I think if we scroll down, we can see like a before and after.
And
Yeah.
enormous lips.
Yeah,
Oh,
she's
she
always
just
had
looks
those
so
puffy.
different, though. She
Her face
looks
just looks puffy,
she
though.
looks
I
like she
mean,
had an allergic reaction.
right. That's why I'm telling you she had a fat transfer and it just hasn't settled down yet
Yeah.
because it's like
She's
everywhere.
so pretty, though. Like, her before picture, like, she didn't need any of that.
No, not at all. But that was also 5 years ago, so who knows? But again, I had a fat transfer to my face like, I don't
We just
know,
need it to settle.
10
But she
years
also looks
ago,
she
and
has
I looked like a pumpkin for like 2 weeks. So,
she looks like she's had a lot of other work done, though, so I don't think that
I don't
now's the
know.
time to start denying things.
Oh, right. Yeah. You're like, "Girl, you've had a bunch of stuff." So, I think
Yeah.
she's just trying to deal with the fact that her face was swollen and who knows? I mean, when you do these like less invasive procedures, there's the patients that you put the topical numbing cream and their face looks like that. And you're like,
Oh, yeah.
this is going to go well. Like if
Mhm.
you're already going to get swollen with just a numbing cream, then yeah, probably going to take a little while for the puffiness to go down. And maybe you could have done a steroid burst or something to get it down, but you're really kind of stuck.
Yeah.
So case in point, when I had my face injected with fat, almost on a bet, um, it was kind
She
of a
does the
bet.
craziest things.
They were like, "Oh, yeah, no, 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 you can do this under local." I'm like, "Really?" And the surgeon I knew was like, "Yeah, yeah, yeah, I'll do you tomorrow." So, anyway, yeah, my face was hella swollen for 2 weeks, and I felt like I looked insane, like, Larsa looks right now,
Yeah.
but,
You just
it
have
went
all the
away.
time in the world, like, you're not doing appearances all the time, like, just take the 2 weeks
Fucking
to sit in
schedule
your
it.
bed.
Yeah, so I
Yeah.
guess she was on a segment of Good Night New York on Wednesday, and people were freaking out. I mean, it's scrutiny.
We hope that settles. That's all I'm gonna
Yes.
say. If it doesn't,
Then maybe go back and ask for a
yeah.
refund. Okay, so Kim Kardashian fans flip over bizarre Korean procedures that include an injection and eyebrow tape. Okay, her Instagram post, I feel like she just does shit now at this point to like,
Yeah.
what's going
She's
on?
always posting her random facials, like, what, the
This is like
vampire,
this
the
I don't know what's going on here. Are they drawing blood? That's a lot of blood. Like,
salmon
they are
sperm.
injecting blood? You would never inject blood in is that an IV? You're the
Sis had
paramedic.
her
What the
arm
actual
injected
fuck?
with a purple liquid as she
It
was
looks like blood.
what would the purple liquid be? A smoothie?
What are you injecting into your arm? Looks like a smoothie. Honestly, I think she's having
I've
stem
never
cell
seen that.
treatments, but what ghetto medical person is doing this? First of all, let's 10 things wrong with this photo.
She has no
Go.
gloves on.
Number 1.
A purple also, they just, like I'm just confused on the tape job. It's
The
literally leaking at the s
at the
there's so
hub,
many yeah, there's so many things not right with this photo.
the
Is that an
gauze
IV or are they just shoving, like, a hypo in her arm?
with a giant syringe, like, how are you gonna push that through?
There's they're gonna blow the vein.
I don't know what's
I'm
going
just
on.
confused on where it's even
I feel like it's obviously a stage photo by someone who has no medical like, just hold the syringe up next to my arm and,
yeah, throw
what?
some tape on it.
Ugh.
I don't know, I'm very confused, so if
Like, what
anybody
angle
wants
is
to
that? What are we doing? And no, it's not a smoothie, it's clearly blood, but, like, gross. Gloves. I just have to say the gloves is just
I
a
don't think that's how you do a
deal breaker.
blood
And then does she not
transfusion.
have a tourniquet? Are they drawing blood? Are they injecting it? Anyway, article goes on to say she's getting stem cell treatments in Mexico because nobody in America can treat her. Well, let's
Oh,
just say
really?
mhm, for her back pain or something. Um, it's stem cell therapy to help her overcome various aches and pains. She's not the only celebrity to do that. It's just illegal in the US to promote that. So she's going overseas. They went to South Korea, but I feel like they also are she's getting treatment in Mexico, which, as we all know, is fraught with issues because they might not wear gloves. And I also don't understand why some of that paste or whatever that's on her face is only on half of it. Like, what's happening?
I have just so many questions. And was that them injecting? That wasn't stem cells that they were injecting.
I don't know
Was
what they're
that?
doing. You got to spin it down and you wouldn't have a 60 cc syringe up against someone's arm.
And yeah, once you inject it in her back,
Yeah, in the area that needs to be treated. I
I'm
don't know.
very confused.
Sometimes people do infusions, but even if you do infusions, you
That's
need
not
an
how you do
IV.
it. Yeah.
Yeah.
Yeah, you don't just inject it.
Like, what are you gonna do? I am injection of stem cells. Bring it intraosseous, like it's an episode of Grey's Anatomy. Like, what is happening? And then to post that and have no comment about what actually is happening. The eyebrow tape for whatever. If you scroll down, you'll see more eyebrow, like what she taped. I don't like. She
What?
probably had, to be honest, right there, she probably had her brows tattooed and then just put a little tape over it or something. But she's insane.
All of this is very confusing.
But yeah, she talks about getting stem cell therapy that's not approved in the US for good reason
Wow.
because it has no medical merit. Oh, yeah, she's
Interesting.
using the Dazawa Muse cells. I
Interesting.
can't. Also, you can get injections in the US. They just can't label it as stem cell therapy. But the fact that it's a branded stem cell treatment when it's your own freaking cells is bananas. Yeah. Since Muse stem cells aren't yet accessible in the US, I had to travel to Mexico. Great. So disturbing.
We have questions.
Yeah.
I don't even know what the Muse treatment is.
That's what I'm saying. It's some branded nonsense. I didn't look it up yesterday because I couldn't bear it. Branded nonsense treatment that you can only get in Mexico, which means it's not like what?
You can only get it in Mexico. That should have been your first red flag. But we also know Kim K doesn't like to look at red flags. So
Yeah. Okay, so let's talk about anesthesia, which is our topic today. The first celebrity adjacent story is Raven-Symoné recalls suffering a seizure from anesthesia after undergoing her first breast reduction at 15. And then really this story is more about how she got pushed into getting a breast reduction at 15, which is a little on the young side. She said she was influenced by the discretion of adults around her. She went from a triple D all the way around to a B. I'm not sure I know many 15-year-olds who are excited to have triple D surgery. But, whatever. I then, but then that was like a slippery slope. So in an effort to keep the public from shaming her for her weight, she turned to liposuction. I mean, I feel like the era of child actors and child stars continues. It's now maybe YouTube stars, but this is not like when in the whatever age Judy Garland was in, they just put you on pills.
don't know who that was.
Judy Garland, come
Mm-mm.
on.
What
Oh,
was
that's
she
right. You
in?
weren't allowed to watch The Wizard of Oz. It's
Oh,
Dorothy,
I've
man.
never once seen The Wizard of Oz. Out of
True
respect for my
story.
mother, yes, who did allow me to watch it. So, yeah.
Anyway, okay. So back in the day, they just used to put the actresses on pills to keep them from eating so they could stay small. Raven-Symoné's now 38. So 15, 20 years ago, they just said, you know what? Get a breast reduction, get some lipo while you're there so we can just shrink you down, which is, I'm
At
going to say,
15,
bananas to do to somebody who's 15.
I understand the breast reduction. I do. I do feel like we get some younger girls, who just it inhibits a lot, their life, their activities, their sports,
Right.
but getting lipo, I mean, that's just setting you up for
It's terrible.
a lifetime of body dysmorphia somehow. I don't know how, but it is.
Oh, it is. So anyway, so she had I feel like she talks about this. I'm not sure when the seizure. Oh my God,
Caesar.
comes into play. Like, she says she suffered a seizure when she awoke due to the anesthesia. And I'm like, again, I have questions.
Yeah.
Like, what does that mean? Was she shaking? You know how people
I'm
shake?
just imagining. I'm just envisioning, when you wake up, people shake.
Yeah, I think that's what she's talking about as you clear
It's
the
not a
anesthetic.
seizure. Yeah.
I thought it was Demerol insufficiency, but Dr. Abrahams hates when I say that.
Well,
because usually
we don't even carry Demerol.
I know. But in the hospital setting, when people routinely like kind of shake and tremble as they're waking up, the anesthesiologist will just give them some Demerol and it knocks it down.
Yeah.
However, we rarely have patients that do that because of how our anesthesiologists handle things and people wake up pretty smooth. But if they do like shake a little bit when they're waking up, you just have to let them clear the gases, honestly.
Yeah.
But
it's a very short period.
It's like, I mean, a seizure is a short period, but it is weird that they label it as such. And then she talks about how she still has scars. Of course, they don't
magically go away.
And then she said she gained weight and had to go back for a second reduction because they were too big for others. I don't know. She doesn't really say when that was. I mean, again, the one thing about having a breast reduction at 15 is that there is potential that you might need it again because you're not potentially done growing. So
right.
I feel like all of this is rooted in some fact. It's just sad that someone felt so exploited and didn't have the, feeling that they can make decisions for themselves and so much external pressure at that time. That's depressing. But
I feel like it was everyone from that Disney Channel era. Like all I can think of is Hannah Montana. Okay. Miley Cyrus, all those kids that went through that like little couple years of the Disney.
Ariana Grande. If you go back a little bit, it's like Britney Spears, Justin Timberlake.
Yeah. They're just
Christina Aguilera, like all of them.
Yeah.
It's sad. Anyway, It sounds like she's come out on the other end. She's married, she's moved on, and I think she's got a handle on it. So, KK. But, we can talk about the risks of anesthesia. Seizure is generally not one of them, but it's a potential. General anesthesia can increase your risk for seizures, i.e., it lowers your seizure threshold. So does caffeine, just FYI. So do some other things will lower your seizure threshold. I'm not an expert on seizures. You can have a seizure disorder. But we recently had someone that we canceled surgery for because she failed to disclose that she had been hospitalized for seizures within the last 2 months for unclear reasons. And I won't get more specific than that. For patient privacy reasons. And that wasn't the only reason to cancel her surgery. But when I said, hey, this is important because having a seizure for whatever reason, be it a low sodium, being it a withdrawal from a medication or a drug, unknown etiology, all of those things have to be worked out and balanced before you undergo elective surgery under a general anesthetic, because the anesthetics can lower your ability to have a seizure. So
I know I've harped on this so many times. I really don't understand the need to hide things from your doctors when you are going to be put to sleep. Like, I don't think people understand the importance of letting people know your medical history. Like, it's no big deal.
Right. I'm not currently seizing right now was sort of the attitude I got back. So I feel like there's two kinds of patients. The ones that are like, can you do it under local? Because I'm absolutely terrified of anesthesia. Those patients are going to be fine because they usually have no medical problems and they're just, anxious, which I get. And then there's the patients that know there's a risk of having anesthetic. They're on a medication like fen-phen that also makes it a little risky. Like you need to come off of that for 2 weeks before surgery, or you're on a GLP-1, need to come off of that for 2 weeks before surgery. You're actively smoking, need to stop that before having anesthesia. All of these things, those patients usually pretend none of that exists or don't disclose
Right.
it because they're like, I'm sure it'll be fine. I'm like, no, no, no. That's what we're looking for. We were trying to assure you that anesthesia is safe, but it's safe in the context of knowing the full story. So I
Right.
know our general theme today is that anesthesia is safe, but the asterisk is in the context of your medical health. So
Right.
don't mess with that, man.
Yeah. Be transparent.
Don't
Not
go
that
out
one.
drinking with your anesthesiologist the night before your surgeon or whatever that poor girl did in Turkey. Remember the one
She
on
partied,
the,
yeah, she partied with her surgeon the day before and
yeah.
then she died.
Yeah.
You know,
So, what are the most common fears that we hear from patients?
dying, not waking up, and being super nauseous.
Yeah, in that order, actually. What's the most common? Being super
Yeah.
nauseous.
Yeah.
I feel like I've, knock on wood, never seen anybody not wake up from anesthetic.
Yeah.
I've heard of it, but it's usually been like very tragic, extenuating circumstances. But nauseous, high likelihood. And I think we do a lot of things to make patients aware of that and so that they don't wake up nauseous. I feel like our track record's pretty good here.
Yeah.
Again, some of it's the magic of what they're giving you for the anesthetic. Our board certified anesthesiologists minimize the amount of narcotic. It's namely fentanyl that you get IV during surgery when your vital signs indicate that you might be having some discomfort. You're asleep, but we can tell if something's bugging you because your heart rate goes up or your breathing rate goes a little bit faster if you're not paralyzed. And some anesthesiologists will give you extra fentanyl and then you wake up and you want to puke your brains out. So
Right.
try not to do that. Things you can do in advance are drink plenty of water leading up to the days before your surgery, right? What else? What am I
We
forgetting?
also prescribe you a scope patch that you put on the night before, which is super effective. I feel like it helps with the nausea so much. But this also, like, goes into qualifications is and I am not shaming any CRNAs, but I've also had my fair share of surgery, and I think just, like, having somebody who is qualified and knows what they're doing and isn't just flooding you with, drugs to make you feel like shit to get through the case. My first surgery, I had a CRNA, and I wish I would have known the difference, and, actually, like, my pre-op was, like, 2 days before my procedure, and they're like, "Oh, you're actually doing, twilight sedation." I was like, "Oh, what is that?" I thought I was going under general, and, like, "If you wanna pay $1,000 more," and I was like, at the time, I was, like,
No,
21. I was like, "Yeah, no, I am no." And I was puking my entire ride home, I was so sick. It was miserable, it was a terrible experience, and then I've had surgery with, an actual anesthesiologist, and it really could have just been I don't know, but, and I was prescribed the proper medications. I woke up and I felt great. I was like, "I feel like I should be super nauseous right now," and I wasn't, because I was petrified the next time I had surgery of being as
right.
sick as I was, because I couldn't even take my pain meds, I was so sick, um,
Yeah, pain
and
meds
I was
also
fine.
make me hella nauseous. So even with I had C-sections under
Yeah,
epidurals. And again, different contexts. I had board certified anesthesiologists doing my epidural for the C-section. They were elective. But um, when I was in the setting of a place where I actually worked, they're so stressed out about me feeling something. They
yeah,
gave me they just want to cover their bases, give me a little extra. And I'm like, no, no. And
yeah,
even though it was, a spinal anesthetic, I still got nauseous. So I get it. And then so some things you can't control, right? So being young, being female, and having breast surgery are known risk factors for having postoperative nausea and vomiting. But the things we can do are make sure you're properly hydrated, do the scope patch before. There is a medication you can take the morning of that also prevents nausea postoperatively, but it's ridiculously expensive. It's called Emend.
Oh, yeah. We're just talking about that yesterday, and I looked it up, and it was like, if you have no insurance, it was like $900. I was like, won't be prescribing that.
I keep waiting for the patent to run out because, or whatever they call, you know what I mean? So that you can prescribe a generic version of it. When that happens, it'll be a game changer because then people can just do that. Because the scope patch, it's the one you take for motion sickness or seasickness. Not everybody does well with it. Most people do, but maybe 1 in every 30, they're like really drowsy with it, or their mouth is super dry, or they feel like they're slurring. Like it can hit people a little bit hard.
Yeah.
Most of our patients, you put it on the night before, you do fine. And then minimizing the amount of narcotics you get during the procedures, also helpful. So we do that by having them preload with medications like non-steroidals, Tylenol the morning of. Preoperative Tylenol is helpful. We've been trialing the Journavx, which is another non-narcotic. All of these things on board, and then me doing local anesthetic before we even get started. All of that minimizes the amount of narcotic that Dr. Abraham or our other board certified anesthesiologists are going to give. And then you wake up just so much better.
Yeah.
So yeah, not all anesthesia is the same. And you really have to be conscientious about giving them enough fluid, but not too much fluid, and making sure that we do all of these things because honestly, that's the most common side effect is nausea. So that's not the most common fear unless you've had anesthesia and you woke up nauseous and you are like really stressed about that. Most people are worried about not waking up or having something untoward happen, which is less than 1% chance, right? I mean, it's
Right.
really low. We have all the proper things here if you have an issue. So, crash cart, inspections, the really, really rare risk that you get something called malignant hyperthermia. So you get your temperatures go up as a reaction to the anesthetic gases. Also pretty rare and was more common with the anesthesia used in the past, different gases that most people don't use anymore. Um,
And that's a genetic order, correct?
yeah,
So that's why we do a lot of like pre-anesthesia evaluations before your procedure, and we ask if anyone in your family has ever had complications, if
mhm.
if you have any history well known, and that's why you have to let us know like your medical history, because it's important not just for us but for the anesthesiologist to be able to predict or outcomes of cases because say
Right,
you have that and you mark that, but you're like, "Oh, whatever, it's fine." Like, that is a way that you can die. You know what I mean? Like,
right.
it's just, like, small little things.
I think, yeah. So just disclosing your actual history is important, and that helps us decide what the best anesthetic is for you, or if you're even safe to have surgery in an outpatient setting. So, yeah, we face those decisions in the hospital setting all the time. Like, people sometimes need urgent surgery, and you have to balance the risks and benefits. Is it a trauma surgery? Did they just eat? All of those things. However, we're doing elective outpatient surgery, so we are going to maximize your safety. And if it's not safe, then we're going to, politely decline, right?
Right, 100%.
Because we're not taking out your appendix here. Like
I feel like over the years, at least since when I started working here, we've really, upped our, criteria, between getting lab work, medical history. We have certain like ages where we require cardiac clearance, going to see your PCP, getting just like a bunch of things done so we know that you're safe to have surgery.
right.
Um
And it's not just necessarily, although there have been cases where if you tell us, you're otherwise healthy and have no medical problems, you think, well, why do I need your primary care doctor to write a note then? Because sometimes people lie about all kinds of things. But also I've seen patients again, where I was like, well, if you haven't seen anybody in a while, maybe you should just go get checked. And then they unearth, you're literally, I had somebody who had a hemoglobin A1C, which is an indicator of diabetes, and it normally is around 5. Was like, okay, I'll go get some labs. This is back when I was in the hospital setting and it was a breast reconstruction case. Her hemoglobin A1C was 11. 11. What? She walking around ready to go into a diabetic coma, but hadn't seen a doctor. And so you're like, okay, you need to get that checked out. Or the patient I saw a long time ago who wanted cosmetic surgery had a history of hepatitis C. And I was like, okay, well, who's following you for that? And she's like,
Yeah.
oh, I'm praying about it. I'm
Not
like, no,
getting
no, no. They
care.
have medication for it. Your liver, I can't, it's all
Yeah.
about priorities. So, yeah. So if you're optimized and you're healthy, then your risk of anesthesia is extremely, extremely low. And those are the patients that we're going to do elective cosmetic surgery. Um, in certain circumstances, and usually in the hospital setting, we make exceptions because people actually need surgery, right? Um,
Mhm.
but I think sometimes we can tweak it and do certain things under local anesthetic if you're maybe not a good candidate for general anesthesia, but that's generally not why we're doing things under local in our office, right?
Right.
Usually we're doing it under local because it's just
You don't
a
need to go under.
yeah, like we had somebody come in for a labiaplasty consult that asked about going under general anesthesia. And I was like, well, why would you? So the
Yeah.
downside of doing it if you don't need it is that it does take a little bit of time to recover in terms of the grogginess and waking up. Whereas if you do it under a local anesthetic, you up and out of here, like no big deal, right?
Right.
Especially if it's something like labiaplasty where you're still numb. So you don't feel and it's like having a dental procedure. Most people don't need to be under for that. And, once the numbing wears off, you need to be in a place where you can recover well, but you don't need to
Right.
be under a general anesthetic. Eyelid lifts, upper lid blepharoplasty, we do under local anesthesia. I
Mhm.
think we're doing one today, correct?
Right. Yep.
Dr.
Right
Chow has
after
one.
this.
No reason to go completely asleep for us to like remove skin from your upper eyelids.
Yeah.
You just don't need to.
Mm-mm.
Um, you're just adding all those medications that are required to put you to sleep and to wake you up for, something that could be done with just a little local anesthetic. And then maybe we should break down what local versus general means, huh?
What'd you say? What?
Heteronormative, straight local.
Heteronormative, straight local. So here in our office, we do straight local, which is there is no anesthetic use whatsoever. We do give you an option to have it's called an MKO melt, which is a very, very like light dose of sounds scary, but ketamine, Versed, and Zofran, and it's just like having a couple margaritas. We have, I mean, you need a ride home from that, but we have the nitronox in office, which is just like laughing gas. And those are all things that can be done in conjunction with the local, which is just injecting local into the site you're having done. You're fully awake for it. We do IV sedation. Dr. Chow is very big on IV sedation, and she loves doing facelifts under IV sedation. That is still incurs the same cost as going under general, but for a lot of her patients, she does have an older population who it is probably more health conscious to be awake. They're still getting, a good mix of, ketamine or fentanyl, but they're able to talk back. They're able to she make movements during the procedure. You're not fully asleep. You still may remember a little bit, but hopefully the Versed does its job. And then you can just be knocked out. So,
That's the general anesthesia. Yeah.
yeah.
So straight local, we're just injecting, like, you went to the dentist and we're going to numb up the area and do our thing, and you're fully present for the whole thing. That's most commonly labiaplasties for us because people will chit
Mhm.
chat and um, whatever, kind of hang out because you shouldn't feel anything. You won't feel anything. It's just weird. You might feel some tugging, you might feel some pulling, but you're not going to feel anything sharp. We do that under the local. We do the upper eyelids. We do implant removal. We have 4 of them coming up in the next couple weeks. So I will numb your old incision wherever that might be. So inject local anesthetic, make an incision. You won't feel anything. And then you'll feel pulling and tugging as I remove the implant. And then I close up the incision. So you can be fully awake for that. But if you're a little bit anxious or nervous, then like Bree said, you can take the sedative, you can huff on the Pronox. You just need a ride home. And then, yeah, IV sedation. I think one of the things that the older patients who are getting like facial rejuvenation surgery appreciate about that is that you're less groggy. You can have something called uh, a post anesthetic cognitive delay, or where you're just a little foggy, and that can be for a few days afterwards, and it's harder hitting for patients who are older, like 60s, 70s. Again, if you think you're prone to that or you are older, again, the anesthesiologist can tweak things so that they're not they're minimizing the amount of medications you get intraoperatively so that you don't wake up as groggy and having to clear that. But yeah, IV conscious sedation, man, you guys do the facelift, wrap them all up, and they walk out.
Yeah. We did one not too long ago, and the patient, I mean, I was in the patient's face the whole time, but she just opened her eyes and be like, wow. She actually offered to hold one of the retractors. She was like saying the names of thing. It was hilarious. She was so funny. But people do so well. And I think I was just as surprised because I had never done a facelift under IV sedation, and people do great. Would I
Yeah,
recommend it for every procedure? Absolutely not.
no. And there are
Definitely.
certain things that are a little. So one of the things about IV sedation is sometimes patients are interested in it because they think it's going to be cheaper. In our office setting, we have our anesthesiologist does the sedation, so it's not cheaper. You're still paying for the anesthesiologist to be there. So if you're doing, I don't know, if you're doing IV conscious sedation, maybe with a nurse, then maybe it's a little bit less, but we don't offer that. So you want somebody, this is where people get into trouble. You want to make sure somebody certified in sedation who is not the same person as your surgeon is doing the procedure.
They can't do
So
both.
you should not be doing both. It's a conflict of
You
interest.
just scrub out every time you have to push
uh,
meds.
well,
You
so you're
can't
not
monitor and watch and do
you,
surgery, and
right.
none of
So
it
you're
works.
no. So generally speaking, you're not pushing the meds, but you're directing somebody. So you're in charge of the sedation as well as doing the surgery. And I think it's a little bit arrogant to think that you can do both and do it well. So if there's any issues, like if you're doing a colonoscopy, sure, you can direct the sedation maybe. But a
Right.
facelift, like maybe you should be focused on the facelift and let somebody else monitor the patient's vital signs, be writing that stuff down every 5 minutes, assessing whether they're feeling pain, like dealing with all of that, and you just focus on doing the surgery and not saying anything inappropriate because the patient's awake. Right? Like that's already energy.
I made a joke in one of
Ugh.
Dr. Chow's facelifts. The patient was awake and I said, "Sorry, first day." And she was like, "Oh, wait, it's not her first day. I swear." I was like, "Oh, it's it
Just
was
a joke we have.
it was
Sorry.
just a joke and it was something so silly."
Yeah,
Yeah.
that's like
It's
that. I feel like
me and her thing that we say, and yeah. So I learned my lesson there, but she does not like my first day jokes.
right. So you do have to be a little bit more cognizant. But I do think if you're going to do it under IV sedation, an actual provider who's responsible only for the sedation should be doing that. And the surgeon can be doing surgeon things. And when you do see like horror stories about people having horrible outcomes
The
after having
scrub
some,
tech doing the anesthesia.
it's happened in San Diego where someone
Yeah.
Yeah. They did not have an anesthesiologist. They're doing a breast augmentation under, I don't know what, IV sedation by the scrub tech. No one else is licensed to do anything. And then you have
Crazy.
an outcome. It's awful. It's so awful. And it's happened. I remember reading a story about it. We had to when I was in training about a guy in Manhattan that was doing that. He had built his own little OR and he was doing twilight anesthesia, facelifts, and somebody crashed and died. And there wasn't, it's just you and you're doing all of it. It doesn't make sense. It's not worth it.
And how would you manage? I mean, realistically, like, no offense, but surgeons focus on surgery. They're not managing the airway. They probably haven't done anything airway since they've been in a hospital.
I know.
You
We're
know?
managing to not knock the airway out.
Exactly. Like, there's no way if there was an airway emergency that anybody else would be able to manage that appropriately. There's many different positions that are needed. If there was an emergency and having people that aren't qualified to do those positions, you know what I mean? Like, if something were to happen, we all have very strict roles. We have policies, we have procedures on how to transfer patients to hospitals. We have certain things. Anesthesia would be on airway. Most likely, I would probably be on compressions. You're going to be
Right.
directing meds. You have a Zella who's going to be getting the crash cart and like, everyone has very specific roles, and you can't do that with unqualified people that don't know what they're doing.
Horrible.
It just sounds like a bad idea.
Yeah. I feel like we take safety pretty seriously, even though we come across as pretty lighthearted. We don't F around with it. And that's why we have other surgeons that operate here. That's why, as much of a pain Dr. Abraham can be sometimes, I like it. Where he's like, what? No.
If you're listening.
He's not listening to us.
Absolutely not.
So there's a lot of like we're keeping the patient warm. That's like my favorite thing to bug Dr. Abraham about is the patient temperature because our room is hot. There's just so many little things that you're taking care of as a group collectively.
Right.
I think we mentioned CRNAs and I don't want to have CRNAs come at me, but the difference between the two of them is as is most things in this country complicated. So a CRNA is a nurse anesthetist, say that 10 times fast. So they are someone who went to nursing school, generally did a higher level of nursing like ICU in order to get qualified to go to this special school where they do anesthesia. Originally,
it's
the
a
idea was
master's program that is about 22 months.
Yeah, 2 years. So not medical school and an anesthesia residency, which is like 5 years, or specialty anesthesia. You know what I mean? So not 9 years, but 2 years or a little less than 2 years. Ostensibly, they were supposed to be extenders, so they should be practicing under an anesthesiologist, but it gets muddled from state to state. So just like a nurse practitioner. So in some states, they can practice not technically independently, but they're practicing under the auspices of the surgeon. And in other states, they have to be under an anesthesiologist, and an anesthesiologist is then responsible for 3 or 4 CRNAs. So it's like a pyramid scheme. Like you can run 3 or 4 rooms because the anesthesiologist is monitoring all 3 or 4 CRNAs. That was the original game plan. But now they can do anesthesia on their own in an outpatient setting, and the person responsible for them is the surgeon, which again brings me back to the whole, sure. Have I worked with CRNAs in the past in hospital settings that were amazing? Yes.
Mm-hmm.
That I thought could rise up to the level of the anesthesiologist? Sure. But do you know if you're getting the CRNA that just graduated last year or the Navy guy that got kicked out to Afghanistan and had to function as an anesthesiologist under some really crazy conditions and is not, fazed by anything and is going to practice safe medicine? Impossible to know. I will say in San Diego, there are some retired Navy CRNAs floating around that do outpatient surgery, and they're good.
I know some phenomenal CRNAs, but like you said, you just don't know who you're getting.
Gonna screen them? Yeah.
Right.
So.
It's like going to, here's my analogy for the day. I'm thinking about the Amazon Prime trucks, but it's like going to a med spa and you have these nurses who are injecting under a doctor. You know what I mean? You don't know. You can go to a really crappy med spa and get a crappy nurse who doesn't know how to inject, where they're injecting, or you can go to a phenomenal one and get a really great injector. You just don't know, and you don't want to learn that by
The hard way.
the hard way. But there are some phenomenal CRNAs. And I worked with a bunch of them, CRNAs at Camp Pendleton Hospital who did a great job, who actually anesthesiologists called when they had a problem or like a heart stick or something, like, you know what I mean?
Right.
But it's.
I will say the Navy CRNAs, are solid.
Yeah.
So if you can find one of those, because they are put in positions where they almost have to practice independently and are really good.
Yeah.
Yeah.
So no shame, it's just education differences.
Yes. Just make sure you're educating. Just learn about things before you, take the plunge. Or, again, disclose everything before you allow us to make those decisions for you. And I think, is there a big anesthesia myth we wish would disappear?
I don't know. I feel like people, I really don't know.
No, I think it's the risk of dying, I think is,
Yeah.
and it happens to be our population is usually women who have children and are worried about, relinquishing control of their breathing and everything to somebody for
Right.
several hours and worried about how that's going to go. And I get it. Like,
Yeah.
I too have been under anesthesia and was a little stressed about it. And I think it's interesting that my male colleagues who are also surgeons were like, why are you worried? Like, you just get a nap. And I was like,
Yeah.
okay, someone's
literally
breathing for you. Awesome.
Close your eyes and then you wake up literally like 1 second later. I'm always like, my skin looks so great because I feel like that's the most hydrated I've been during surgery. Dr. Ibrahim did not like that answer when I said it. But we like safe surgery. He's very like, he is conservative. He does love safe surgery. He will go through your background, your charts. He just wants to make sure all his bases are covered. Like we said, this is an elective office where we want happy surgery. We want good outcomes. So there's no reason you should be coming in to get an emergency breast stock if you have poor medical history. It is not worth it. It is not worth, the risks of something happening during surgery. It's just not.
Right.
So
You
go through a whole bunch of different people, to make sure that you are a good candidate. And
yeah. I feel like you should listen to this episode and then follow it with what makes good recovery, because those two things are important parts of having surgery. Making sure your ducts are lined up, you're getting the right anesthetic for the right procedure, and it's safe. And then making sure you've given yourself the appropriate time and resources to recover so that everything goes as well as expected.
Wherever you go, I just have to say, ask a lot of questions, something I never did before I started working here. Ask what kind of provider is doing your anesthesia, ask what kind of anesthesia is best. Like, just ask all the questions, make sure, their accreditation, it's really important to make sure, like I said, we have a fully accredited OR. We have everything that we need here for pretty much all, like if things were to go wrong, so.
That's how we ward off evil spirits.
Yeah, good juju. That and some sage. We saged the office the other day, and it just smelled like we were just smoking marijuana. Like we were getting high as a kite in here. I was like,
it was strong.
Gosh. I came home and I smelled like it. And they were like, did you smoke? I was like,
we needed a cleansing.
Yeah,
it's okay.
Juju.
Okay, so I think we've covered most of the basics about anesthesia and elective surgery, but if you have questions or want more information, like and subscribe.
Yeah.
And put your questions in the comments because we want to know what you're thinking and what we missed.
Yeah. Lock in. I've been waiting to say that.
Lock in. All right, we're going to scrub in
and scrub out.
If you're listening today and have questions, need info about scheduling, financing, reviews, or photos, check out the show notes for links. Restore SD Plastic Surgery is located in La Jolla, California. To learn more about us, go to restoresdplasticsurgery.com or follow us on Instagram at Restore SD Plastic Surgery. If you enjoyed this episode, please share it and subscribe to All the Bees on YouTube, Apple Podcasts, Spotify, or wherever you like to listen to podcasts.